Sisters, Marek. Just real quick, we had last week I was presenting. I'm your friendly neighborhood Seventh-day Adventist health insurance professional, and we had a presentation last week, and there were some questions that I just wanted to go over today that were answered, health insurance and benefits questions. The first of those is who gets Medicaid and Medicare? Very good question. Medicaid, again, Medicaid is the federal government program. As I mentioned last week, health insurance uniquely is the only type of insurance that the federal government is involved in. The federal government, we through paying taxes and all that, we actually pay for Medicaid and Medicare. Medicaid is a program designed that the payment of it is a social welfare program, and you can qualify for Medicaid primarily if you're a resident. You don't necessarily have to be a citizen, as I recall. State of Texas, with Medicaid, keep in mind, every state is the one who administers the rules of eligibility. And that's a very big factor because, for instance, being eligible in the state of Texas for Medicaid versus being California, it may be two different things. So on Medicaid, what you want to do is check with the State Department of Health and Human Services. They will give you whether or not you qualify for Medicaid. And Medicaid is a great program. Basically, it gives you major medical insurance, and just like Medicare, most of the premiums are paid for by all of us. It's a socialized program. And so Medicaid is for people under 65 years of age, and eligibility is determined by the states. And then Medicare is a federal program for those of you who have reached the age of 65. Once you have reached 65 and you live in the United States, you're a resident of the United States, you're a citizen of the United States, you're eligible for Medicare. And Medicare is the federal program only. Medicare is administered and underwritten, and all the money is paid for by the federal government out of the federal treasury. And so the qualifications for Medicare, very simply, if you're over 65, it's Medicare. If you're over 65, you could be eligible for Medicare and Medicaid. And so the key here is federal government for Medicare. There's all websites, medicare.gov. State government for Medicaid. And so if you're 65 or older, you could be eligible for both. And if you're 65 or under, or if you're under 65, you could be eligible for Medicaid. And then the question is, why do we have these programs considering it'll get progressively more expensive? That's a political question. It's completely political. We started with Medicare back in 1965. And so again, and obviously as you see play out in the political arena, it's a question that constantly gets asked. What in my belief is that, again, we all here are citizens of the U.S., we're all Christians, we're all Adventists, we're all residents of the United States. My role is, and what I believe is, basically we have the programs, they're part of and how you feel about the program, you can express that. All I tell you is you can express that during the elections that we have every 2 years, because it's the federal government that determines what Medicare and Medicaid, the future of that. And so the issue is that, like I said, it's a program, and so basically Medicaid, Medicare, Medicaid state, and Medicare is federal. What, if any, are the benefits or reasons why someone would choose something other than a PPO? Primarily cost. As I mentioned last week, you always want to get a PPO. Why? Because a PPO means that you're covered anywhere in the United States. You go to any healthcare provider, if you have a PPO, it means your benefits are going to be available. Um, the other ones are HMOs and other things besides PPOs. And the reason why generally people choose that is primarily because of cost. Uh, for one reason or another, a PPO may not be affordable um, from a budgetary standpoint for what their premium is. Um, and an HMO or anything but a PPO, the key thing to keep in mind on medical insurance, just know where your providers are. And if you're in an HMO or an EPO, whatever it is, there is a network that's assigned to it. And that's how you get health care. Now, there also is what is growing, what many of us are going to be able to take advantage of, is that there is a trend, and again, this is all based upon what the federal government does, what our elected leaders do, but there is a trend now where there are direct primary care clinics. I know I'm a member of one here in San Antonio, and what that is the trend is we're trying to go back to where all of us have a doctor that knows us, that knows our case, that knows our case file, that builds a relationship. And what that is, it's called direct primary care. And what that is basically it's a doctor, an MD, who has a subscription service where as an individual you can subscribe to that program. And there's a lot of talk going on, and really where the government comes in is that hopefully direct primary care will start becoming part of Medicare and Medicaid and all the medical insurance programs, so that they include that in their offering, so that you're not, because right now one of the frustrating things with medical care is my doctor in network? Am I getting services that are in network so that they're covered? And so hopefully that is being done. But the answer to the question on that is, why would someone choose something other than a PPO? It's usually primarily because of cost. And what I would suggest is try to always find a PPO plan. What is the difference between a deductible, max out-of-pocket, premiums, and copays? Deductible is what you owe. It's what your financial responsibility is. Maximum out-of-pocket is how much you will owe if you have a catastrophic illness. Any policy, the deductible is what you're going to be financially responsible for. That is at the beginning of your care. So deductibles range from, I think the maximum deductible by law is roughly about $9,500. So in your plan, which we talked last week, look at your plan documents, look at the summary of benefits. The deductible is how much you're going to be responsible for if you seek any care. And that could be $1,000, $5,000, and you choose that with your plan. And so that is the choice that you make, or you may not have any choice in it if you're in an employer plan, if you're in a federal government plan. They tell you what your deductible is. And the deductible is how much that you're financially responsible for. Maximum out-of-pocket is how much you are totally going to be responsible for if you actually seek care. So deductible could be $1,000, $2,000, $5,000. Let's say we have a deductible of $5,000. Maximum out-of-pocket is $10,000. Well, what that means is you're going to pay the first $5,000 of your medical bills, and then after that it'll be a cost sharing, and then you'll be totally responsible for $10,000. So if you seek care, your total liability is your maximum out of pocket. And then premiums, that's how much you get charged every month or every year, every quarter, however you pay it. That's how much you get charged for having the policy. And then co-payments is the co-insurance. What that means is when you go seek care, your plan or your benefits are going to cover a certain portion of it. You're going to cover a certain portion of it, and that's what co-pays are. What are your thoughts on supplemental insurance? I recommend it strongly. Basically, it's going to be needed more and more because the only way we're going to keep costs down of these policies and what's happening, by law it's actually done, your deductible and your maximum out of pocket is going to continue to go up, meaning that it's going to be more your responsibility that if you get sick or if you need to have care, you're going to end up having to have more responsibility out of pocket. Supplemental insurance is a way to cover that where you actually insure that. In what circumstance would that be more beneficial, getting an insurance that covers everything you need? Again, it comes down to cost. Comes down to cost. To get if you're under 65 especially, even in Medicare, your premium is your Part B premium, $175 a month, going to keep going up, probably going to keep going up as we go along. And then in Medicare, you have to pay a supplemental. You have to buy a supplemental policy, and that's going to be a premium. That keeps going up. And then, or you can switch to Medicare Advantage, but you will have an out-of-pocket. And that out-of-pocket keeps going up, and that's where supplemental gets into it. And it really boils down to cost. How much are your premiums? How much are you paying on a monthly basis? And that's what you get with an agent. There's plenty out there. Just talk with an agent. Or actually, it's a good idea to do it yourself. Sit down and figure out, get all your options in front of you, put it down together, and see what's going to be your lowest cost. How often do health insurance codes change? Every year. And should I keep up with those changes to avoid incorrect charges? Yes. And your charges are your responsibility, I tell you. One of the things that, and what I would recommend is there's actually a field in the healthcare business, it's now called patient advocates. Strongly recommend you look at it. Find a patient advocate. As a broker, I not only sell the product, but also I'm an advocate for my clients, because what we're finding is the claims and the billing is very, very confusing. And so you need to make sure, you need to audit that, and unfortunately those rules are changing every year. And I think that's about it. Thank you very much.